Hey there, welcome back to How to Medicate and welcome to this new video on how to use fluoxetine, also known as Prozac. This video is part of a video series on mental health problems, and for those of you interested, check out the playlist in the description after watching this video, of course. For those of you meeting for the first time, my name is Raoul. I'm a medical doctor from the Netherlands and I'm making weekly medical videos to educate myself as well as you, my viewers, because I believe that medically educated people make healthier decisions, which is the whole point of this video and this entire channel. This video also comes with a quick disclaimer. It's meant purely informative. This is not medical advice, and if you're looking for medical advice, then you should always contact your own doctor. And now quickly, let's get started. The generic name of this medication is fluoxetine, but it's sold under several brand names like Prozac, Sarafem, Rapiflux and Selfemra. This medication is available as dissolving tablets or capsules. Now then, how should you use it? If you want to use the capsules, make sure to swallow them whole with half a glass of water, do not break them and do not chew on them, as this can decrease its effectivity. If you want to use the dissolving tablets, allow the tablet to disintegrate in water, stir the water and drink it. Afterwards, rinse the glass with water and drink that water too. Then it is advised to take fluoxetine in the evening if you are experiencing its dazing effects. However, if it's causing an agitation effect, then you should take it in the morning. Furthermore, if you do not experience any improvement in your symptoms within 6 to 12 weeks after starting fluoxetine, it probably won't be effective for you. However, if you do experience an improvement of your symptoms, then your doctor will probably advise you to use it for 6 months up to several years. Fluoxetine itself is part of a group of drugs called SSRI, Selective Serotonin Re-uptake Inhibitors, which play a role in the treatment of several mental health problems. They can be used to treat depression, an obsessive compulsive disorder, OCD, and bulimia nervosa, which is an eating disorder. In children older than 8 years, it can also be used to treat a severe depression, which is always done in combination with psychotherapy. Which brings us to the correct dosages to use. Here I want to mention that I cannot provide you with a specific dose, because these differ too much depending on your specific indication of use, the symptoms you might experience, the side effects you're experiencing, and your blood levels of fluoxetine. Therefore, always use the prescribed amount and frequency your doctor prescribed you. However, the usual starting dose a doctor prescribes will be 20 mg a day for an adult. This can then be gradually increased up to 60 mg a day if necessary. For children older than 8 years old, the usual starting dose is 10 mg a day, which again can be increased up to 20 mg once a day if necessary. Now, fluoxetine itself is a very effective drug, but unfortunately it can have some side effects. I will discuss some of the most common ones in this video, but if you're looking for a complete list, then ask your doctor or check your leaflet. Very commonly it might cause nausea, diarrhea, insomnia and fatigue. Often it causes a decreased appetite, anxiety, a decreased libido, sleeping disorder, dizziness, drowsiness, yawing, vomiting, erectile dysfunction and weight loss. And uncommonly it might cause suicidal behavior, mood changes, abnormal orgasms, memory impairment, a low blood pressure, gastrointestinal bleeding, muscle twitching and changes in your blood values. Considering safety, please be careful when combining fluoxetine with alcohol, as this might increase its dazing effect. In addition, it can also be dangerous to drive while using this drug, as it can cause you to become drowsy, sleepy and or dizzy. If you are experiencing any of these side effects, then please do not drive. Furthermore, fluoxetine can have an interaction with other drugs you might be taking. Therefore, always discuss this with your prescribing doctor. Lastly, we end off by taking a look at the safety of fluoxetine during pregnancy or while breastfeeding. And unfortunately, fluoxetine can be dangerous in both cases. However, there are some exceptions. Therefore, always discuss this with your prescribing doctor. Now, I hope you know now how to use fluoxetine, as that was the general idea of this video. If you have any questions, let me know in the comment section below and I will do my best to answer all of them. And for those of you that want to keep on learning, check out the playlist in the description or I will put it up there. Again, thank you all for watching. If you did enjoy, please leave a like. This will help out the channel tremendously, and consider subscribing so you never miss such an awesome medical video again. And for those of you that can't get enough, I made an Instagram account at How to Medicate. Check out all our content there. And as always, I will see you next week with a new video. Bye bye.